continuation to the discussion. So, peritoneal dialysis. So, what is the difference between hemodialysis and peritoneal is, in hemodialysis, it uses a machine as a filter by filtering the toxins from our blood. So, unlike in peritoneal dialysis, instead of using a machine, it uses the lining of the inside of the belly as a natural filter for blood. So, dialysis is the cleansing fluid. So dialysate output is decreased. So turn patient from side to side to promote circulation. So this is circulated through, the cleansing fluid is circulated through the catheter inside of the abdominal cavity with the peritoneal cavity. So it uses by absorbs waste products from blood vessels in the abdominal lining, the peritoneum, and then thrown back out of your body and i-discard na siya. So in peritoneal dialysis, so the complication of it is prone to infection. So can be an infections of the abdominal lining that leads to peritonitis. So we need to monitor WBC because decrease of WBC will make the individuals prone to infection. Then monitor body temperature. If there is a increase or hyperthermia ang individual, is it would indicate there is a presence of infection. So dialysate is cloudy. So if ang diacylate is cloudy, so mag-indicate na siya o indicate inflammation sa atong lining. So board-like and rigid abdomen, if there is a presence of an infection, then would lead to peritonitis. So peritonitis is the inflammation of our peritoneal lining. So don't include diacylate solution in the output of the client. So expected is mag-decrease ang weight. So monitor weight before and after to have basis, then decrease creatinine and BUN or BUN. So heart block occurs when the signal of our heart is blocked. So mag-decrease ang iyang cardiac output kay dili man makapass through ang atong signal. So mag-decrease ang tissue perfusion kay dili man siya maka-circulate sa atoang peripheral parts, atong peripheral system. So Parkinson's disease. So what is Parkinson's disease? This is a brain disorder that leads to shaking, stiffness, and difficulty with paglakaw, sa imbalancing, and coordination. So decreased dopamine in the basal ganglia. So Parkinson's disease is there is a decreased secretions or productions of dopamine. So levodopa. So giving levodopa in order to increase the production of dopamine. So our management is avoid vitamin B6-12 food because vitamin B6 would decrease the effectiveness of levodopa. So cardinal signs is, this is the signs most commonly seen in individuals who have Parkinson's disease. So tremors is non-intentional or shaking, is muscle rigidity, and bradykinesia. So ang pill rolling is usually seen in Parkinson's disease. They are like naga-roll og pills sa ilahang between index and thumb. In microphonia, so microphonia is weakness of voice. So ask your client to speak aloud to be aware. So moni siya ang the way we assess them if there is a presence of microphonia by letting the patient to speak aloud. So arthane and congentin are anticholinergic. So this would results to decrease muscle rigidity. So myasthenia gravis. So this is a chronic disorder in which antibodies destroy the communication between the nerves and muscles, so resulting in a weakness of the skeletal muscle. So Ang tensilon test is the test conducted to determine if there is a or to diagnose myasthenia gravis. So decrease acetylcholine and increase cholinesterase. So decrease acetylcholine because binding this to its receptor activates the muscle and causes muscle contraction. So we need to decrease the acetylcholine and increase cholinesterase because cholinesterase weakens the muscle, so that makes the muscles relax. So muscle weakness, so priority airway, no tranquilizer. Kay if there is man tranquilizer, so tranquilizer, then morphine, sulfate, muscle relaxant, and neomycin. This will trigger the symptoms of the myasthenia gravis. So cholinergic methanol. So this is a drug to treat myasthenia gravis. So if increase ang muscle strength, so cholinergic methanol, so if increase ang iyang given, or so it will lead to increased muscle strength. So the antidote is the antidote is 80 sulfate. So under medication, so myasthenic crisis, so give cholinergic. So if over medication naman, so cholinergic crisis, so give A380 sulfate. So what multiple sclerosis? So multiple sclerosis is the chronic disease affecting the central nervous system, so our brain and spinal cord. So this occur when immune system attacks nerve fibers. So in multiple sclerosis, demyelinization of the myelin sheath. So demyelinization of the myelin sheath, so this results in damage to the covering called myelin sheath that surrounds in our nerve fibers in the brain, optic nerve, and spinal cord. So when this damage happens, so nerve impulses slow or stop, that causes neurologic problems. So in Charcot triad, so in multiple sclerosis, this will usually seen. Charcot triad is intentional tremors, which is the coordination problem. So the coordination problem, scanning of speech or slurred speech, and three more. Then in three more, the nystagmus is an involuntary rhythmic of the eye from side to side, up and down. So in visual disturbances would lead to diplopia. So this visual disturbances, so diplopia. Diplopia is double vision or seeing double. So next is pancreatitis. So pancreatitis is the inflammation of our pancreas. So our pancreas produces enzymes that help the digestion and help the body regulate the glucose level or to process sugar. So if our pancreas inflamed, so there would be an autodigestion. So a process where our pancreas enzyme destroy its own tissue that lead to inflammation. So ang mag-cause siya ay mag-results of pancreatitis if there is a excess or abuse intake of alcohol. So mag-cause siya bleeding, kaya na naman ano naman siya for ulcers, then mag-bleed siya, then shock. So elevate amylase. So moto i-elevate na to ang amylase to provide so increase amylase because our pancreas does not function well because instead of functioning to help digestion, so gina-attack naman niya ang sariling tissue. So we need to elevate our amylase to help digestion. Next is rheumatoid arthritis. So rheumatoid arthritis is an autoimmune and inflammatory disease. So it attacks healthy cells in the body by mistake. So it causing inflammation, painful swelling. So mainly attacks our joints. So no specific diagnostic test for this. So NSAIDs and ASA is antipyretic, analgesic, and anti-inflammatory. So these drugs are given to manage the symptoms of rheumatoid arthritis. So synovitis. So synovitis is an inflammation and swelling. So pain and warmth. So if there is a presence of rheumatoid diseases, we can see that there is a swelling that if you touch, it feels warm. Then also would, it would indicate redness. So if there is a synovitis, so there would be that would result to pannus formation. So pannus formation is a type of extra growth in your joints that cause pain. So mag-result siya into fibrous ankylosis. So there is a limited joint movement. So it is needed to have or undergo a bony ankylosis or joint fixations to relieve pain. So avoid flexion and promote prone position. So our nursing management is to avoid flexion, promote prone position. So gouty arthritis. So what is gouty arthritis? It is a common form of inflammatory arthritis that is very painful, that affects one joint at a time, often the big toe joint. So mo ni siya katong sa arthritis located in our toenail or our toe joint. So if there is a gout arthritis, so increase ang uric acid. Kay di ba, if decrease ang excretion sa ato ang uric acid, it is commonly cause of gout. So if ang uric acid, so ang atong uric acid is normally excreted or removed from the body by the kidney. So if there is a decreased excretion, so it would lead to gout arthritis. So if there is a gout arthritis, so increase ang atong uric acid, so allopurinol, and avoid organ meats liver, because organ meats liver are particularly high in purines, which increase your uric acid. So it is needed to avoid such organ meats. So toffee ear, so if you have a increased uric acid, so there would be a accumulation of toffee like ear size or size that is seen in the toenail, kanang more mag-develop good siya. So osteoarthritis. Next is osteoarthritis. So this is the most common related with aging. So in elderly people or adult is who have osteoarthritis. So pain after weight bearing exercise or activity. So if mag-occur lang ang pain ani if mag-increase ang ilang body weight o kanang exercise or bearing exercise or activity. Like, so it is needed to rest to relieve the pain and weight reduction, because if too much, if bugat na kayo sila, ang ilang bone is ang osteoarthritis will trigger. So it will cause painful in their joints. So weight reduction. So diverticulitis. So diverticulitis is a inflammation. So in diverticulitis, so left lower quadrant pain and low fiber diet. So if there is a diverticulitis is there is a small bulging pouches in our diverticula, in the digestive tract. So if there is a presence of inflammation, so it would result to diverticulitis. So low fiber diet to allows the bowel to rest by decreasing the fecal volume. So we'll continue for the next